I coined the term. I sort of invented it now about 15 years ago in an article in the New England Journal. And what it is really is it reflects a major change in the organization of American hospital care. In the old days in the U.S., if you were a sick patient and came to the hospital, the expectation would have been that your primary care doctor would have been in charge of your hospital care. That might have worked 30 years ago when patients who were in the hospital weren't that sick and the pace was pretty slow. It just doesn't work anymore today. The doctor in the office is extraordinarily busy, having groups of physicians who are really invested in making the system work better, not just in caring for their individual patients. Since the time I coined the term, this has become the fastest growing specialty in American medical history. There are about 30 and 35,000 hospitalists now. At my own 600-bed hospital, I have 50 hospitals that work for me. It's a natural alliance with hospital leaders and managers, and they work very, very well together. Conceptions, I think, are mostly correct. I think that one of the things we've learned in the last 20 or 30 years is despite having an amazing workforce, the care we provide is not as safe or as high quality or as satisfying as it should be. Not only not as good as it should be, but too damn expensive. We have to train new ways of thinking. I mean, the great doctor of the future is going to look very different than the great doctor of the past. You know, he or she may be, I hope, is still very smart and a very good diagnostician, but won't look like, you know, House MD. It's going to be someone who's going to be a team player, who understands the role of the system, the importance of checklists and information technology, and teamwork and culture. And so I think patients have some appreciation that American healthcare can do better and should do better, but I think sometimes their diagnosis is not correct. They think that if we just had better people doing these things, and I think that's not the answer. The answer is the system.